In a series of 4 free sessions, suicide training is available, suicide prevention training, to those interested in learning how to recognize suicidal behavior and offer help when needed. I'm News 8 digital anchor Luke Laster here from the Wood TV live desk, ladies and gentlemen. Good afternoon. Joining me via Zoom this afternoon, Stephanie Kooistra. She's the Gerber Memorial Community Health Educator and Certified Trainer in Suicide Prevention. Question, Persuade, Refer program. Stephanie, good afternoon. Thanks for taking some time to chat. Tell me a little bit about this training here.
Yeah, sure. So first of all, QPR stands for Question, Persuade, Refer, and it is an evidence-based suicide prevention training that can be completed in a little over an hour. As a part of the gatekeeper training, participants learn how to recognize signs of suicide, learn how to ask the direct suicide question, and then ensure the individual is referred for help. And this is open to anyone, including parents, teachers, ministers, doctors, police officers, anyone who is in a position to recognize and refer someone who may be at risk of suicide.
So
Go ahead.
There is four scheduled sessions here. 3 remain. 1 just went by last week. I'll ask you a couple times just as viewers continue to flow in and flow out. Could you share those locations and dates of those?
Sure. So actually we have 4 upcoming still. We added another one in there. So
excellent.
In Fremont this past week, but we have one coming up on April 19, Tuesday, April 19, and that's at 6 p.m. in Newaygo at The Stream. We have one on Wednesday, May 4, and that's at 5 p.m. at Montague Public Library in Montague. One on Tuesday, June 14 at 6 p.m. at Grant Public Library in Grant. And then one on Wednesday, June 29 at 5 p.m. at Dalton Township Public Library, and that's in Twin Lake.
Excellent. So could you, sorry to kind of cut you off there, could you go back to kind of explaining that QPR training?
Sure. Yeah. So each training takes about an hour to complete. And during that training, we go over some myths and suicide myths and facts that you might hear. So we talk about those myths and then we correct those with facts. We also talk about verbal, situational, and behavioral clues to look out for so you can see if someone might be at risk of suicide. And then we move into the QPR section of the training. So that question, persuade, refer. And so during the question portion, we give participants the tools they need to ask someone if they are thinking about suicide. So we talk about how to indirectly ask the question. We talk about directly asking the question. So sometimes you might start with an indirect question of, I notice you've been unhappy lately. Have you been so very unhappy that you're thinking about killing yourself? We move into direct questions of just that, are you thinking about killing yourself? So with that, we kind of walk through that question part. And during that time, we acknowledge how difficult that conversation is going to be. It will always be awkward. It will always be difficult. It never gets easier to ask someone that question. And we also talk about, if someone were to get upset with you for asking that question, we talk about that might be a temporary upset with you, but really we'd rather ask that question than not have the chance to ask it later. If you're able to if you get a yes from that person that they are thinking about killing themselves, then we want to move into persuade. And during that time, we talk about persuading them to live. So we talk about how to actively listen to someone. We talk about tools to use for that. So we want to make sure we never use the language of, I understand what you're going through. We want to use more of the language saying, I want you to live. Won't you please continue to live until we can get you some help? Or won't you please continue to live? And we want them to know that we're going to be there for them now and in the future. This isn't just a temporary thing. We want to make sure that they know that we're going to continue to be with them. After that, we want to refer them to an expert for help. So we give our participants a list of local resources that they can use if they need to contact an expert. But then also during that time, we talk about gathering a team. It's a team approach. So it should not just be you that is helping that person, but we want to gather some of their trusted friends and allies. So maybe that's parents, siblings, friends, a pastor, minister, other people that might surround that person and continue to look in on them and help you out with keeping them safe during that time of crisis. At the end of the session, we go through a situation. So it's not really a role play, but it's a situation. We kind of walk through all the steps of how you might question someone and then persuade them and then refer them.
As for the first session that has now come and gone, how did that go? Did it go as expected? What did you learn? What was some big takeaways that you could take to the sessions here over the next coming months?
Good. Yeah. So that session went really well. We had a good, participants in that. And with that, I think that it is such a learning curve for a lot of people. So we learned, as it was for us as we got trained in this. So a lot of questions came up at the end asking, how we can do more about the resources, all of those things that we had questions about ourselves when we were getting trained. So we were able to answer a lot of those questions for them.
What was the decision that said, there are several parties involved in making these sessions come together. What were the decision, where did the decision come from to actually hold these?
Yeah, so Spectrum Health strongly believes in serving our community, and what that means is responding to the healthcare needs that are top of mind in our West Michigan area. So this has been top of mind, especially with COVID. We have a lot of people that have been showing more signs of depression, and we want to say that, of course, not all depressed people are suicidal, but most suicidal people are depressed. So with that, there's a growing need for people to be on the lookout, to be trained, and to recognize those signs in other people. So we wanted to make this a community effort to really get the word out and to be able to watch out for each other and care for each other.
At the end of the day, when these sessions are all completed, what are you hoping comes from them, and what will be the next steps after that?
Oh, good question. I think that, just I'm a mother of two teens. I'm a community health educator. I'm out in the community a lot. So I think that we just want to, reduce stigma around mental health behaviors. We want to increase knowledge to the community so that we can really work together and see, mental health stigmas go down and people care for each other in a greater capacity.
Stephanie, if you could just please share those locations again one more time. As I mentioned earlier, some viewers flowing in and out of this live stream just so they have it.
Yeah, so we are offering 4 more free sessions, and they're open to the community. Again, I want to mention they are free to the community. Anyone can attend. We have one coming up on Tuesday, April 19 at 6 p.m., and that is in Newaygo at The Stream. One on Wednesday, May 4 at 5 p.m. at the Montague Public Library in Montague. Tuesday, June 14 at 6 p.m. at Grant Public Library in Grant, and one on Wednesday, June 29 at 5 p.m. at Dalton Township Public Library in Twin Lake, Michigan. And again, they are free to the community. You can register by calling our community health line, and that number is 231-924-3073, or emailing our community health line, and that's communityhealth@spectrumhealth.org.
Stephanie, we really appreciate you taking the time here to tell us about these sessions. Anything else that you'd like to put out there?
No, I just want to, again, I guess, reiterate that this is open to anyone. It is open to parents, to any community member. It is not specific for experts. I think that's one of the myths that we go over, is that only experts can save someone who is at risk of suicide, and that's not true. It really is up to all of us to recognize these signs and to question a person about it, and then get them to that expert to help them out. So we really want to make sure that anyone in the public can come, and want them to know that it is open to everyone and good for everyone to come.
Ladies and gentlemen, if you tuned in halfway through this live stream, or maybe just tuned in now, or want to watch the full conversation back, there's a link attached to the stream that'll take you over to woodtv.com. You'll be able to view that full conversation. Again, Stephanie, thanks for taking the time. Ladies and gentlemen, this has been a look at the Wood TV Live Desk. I'm News 8 digital anchor Luke Lasser. Have a great afternoon, folks. See you around.